You know, your body is talking to you all the time. That dull ache, that weird little flutter, that moment you're suddenly short of breath. But do you actually know how to speak its language? Well, today we're going on a tour. We're going to decode the critical messages our bodies send out when something's not quite right, system by system.
We've all been there, right? You're in the doctor's office, you feel awful, and you're trying your best to explain it, the fatigue, the pain, that general feeling that something is just off. But here's the thing, there's a huge difference between the story you tell and the hard clues a doctor actually uncovers. And understanding that difference, that's the secret sauce of medical diagnosis. So here's our roadmap for this tour. First, we'll get the basics down. What's the real difference between a symptom and a sign? Then we'll dive into the body's major systems, from the heart and lungs to the brain and beyond, to see how this plays out in real life. And finally, we'll put on our detective hats and see how it all gets pieced together.
Okay, let's start with the absolute foundation. Before we can understand what our body is trying to tell us, we have to learn its language. And in medicine, that language starts with two words that people mix up all the time, but they mean totally different things: symptoms and signs.
So here's the crucial breakdown, and it's actually pretty simple. A symptom is your subjective experience. It's what you feel and what you report, like a headache, a wave of nausea, or a feeling of anxiety. A sign, on the other hand, is an objective, measurable piece of evidence a clinician finds during an exam, a fever reading on a thermometer, a high blood pressure number, or a heart murmur they can actually hear. It really just boils down to this: what you feel versus what they find.
Our first stop is the body's engine room, the cardiovascular and respiratory systems. I mean, these two work in perfect partnership, tirelessly pumping oxygen-rich blood to every single cell. So you can bet that when there's trouble here, the signals are going to be urgent.
When the heart, our main engine, is struggling, it sends out some really specific alarms. You might feel a crushing type of chest pain, or this startling shortness of breath. Medically, it's called dyspnea, that gets even worse when you try to lie down flat. Or maybe you've had that weird, fluttering awareness of your own heartbeat, which is known as palpitations. These are your body's emergency flares.
And this is where the doctor's detective work for signs really begins. They might see elevated pressure in the veins of your neck, a clear sign of fluid backing up. Through a stethoscope, they might hear a heart murmur, a little whooshing sound that could point to a valve problem. They can also check for what's called pitting edema, where pressing on your swollen skin leaves a little indent, or even spot a bluish tint to your skin called cyanosis, which is a dead giveaway that your blood isn't getting enough oxygen.
Now, let's move next door to the lungs. The symptoms here can be just as revealing. It could start as just a nagging cough, but it might escalate to something pretty alarming, like hemoptysis, which is the medical term for coughing up blood. You might also notice a wheezing sound when you breathe, or a really sharp, stabbing chest pain that grabs you every time you take a deep breath in. So a doctor looking for signs might see that you're breathing way too fast, or even notice you're using extra muscles in your neck just to pull air in. But check this out. Look at the fingernails on this slide. This shows a fascinating sign called clubbing. The fingertips actually get wider and rounder. This happens because long-term lung disease can cause low oxygen levels, and that triggers changes in the blood vessels at the tips of your fingers. It's such a powerful, silent clue.
All right, next up on our tour, we are visiting the body's complex processing plants, the gastrointestinal system, which breaks down our food, and the genitourinary system, which filters out all the waste.
GI symptoms are things many of us know all too well: indigestion, nausea, a sudden change in bathroom habits. But they can also be really specific, like dysphagia, that feeling that food is getting stuck when you try to swallow, or different kinds of belly pain, from a crampy on and off feeling to a constant, sharp pain that's screaming inflammation. The signs of GI trouble can be written all over the body. I mean, look at the yellowing of the skin and eyes here. That's jaundice. It's a classic sign of liver problems. It happens when the liver can't properly clean out a substance called bilirubin. A doctor might also be able to feel an enlarged liver or spleen, or detect fluid building up in the abdomen, which is a condition known as ascites.
The urinary system, well, it tends to give very direct feedback. Symptoms like dysuria, that painful burning feeling when you urinate, or hematuria, actually seeing blood in your urine, are pretty unmistakable signals that something is wrong. And waking up over and over again at night to go to the bathroom, known as nocturia, is another really common and frustrating symptom. During an exam, a doctor can find physical clues here, too. They might actually be able to feel or palpate a bladder that isn't empty in all the way. A specific tap on your back can reveal tenderness right over the kidneys, which points straight towards an infection. And for men, a specific exam can reveal an enlarged prostate, a super common cause of urinary issues.
Okay, let's move on to the most complex system of them all, the command center. We're talking about the brain, the spinal cord, and all the nerves that control everything we do, from breathing and blinking to thinking and feeling. When the wiring here gets messed up, the effects can be, well, profound.
Neurological symptoms are incredibly diverse. They can be as common as a headache or as frightening as a seizure. A patient might report weakness or numbness down one arm, or vertigo, that awful, disorienting illusion that the whole room is spinning. Even subtle changes, like blurry vision or trouble getting words out, are absolutely vital clues.
So to investigate this stuff, neurologists have a whole toolkit of tests. They check your mental status, test all 12 of the cranial nerves, and look at your reflexes. One of the most famous examples is the Babinski sign. As you can see here, the doctor strokes the bottom of the foot. Normally, in an adult, your toes should curl down. But if the big toe goes up and the others fan out, that can signal a big problem in the central nervous system. It's such a simple test that reveals a ton about the brain's wiring.
For our final stop, we're going to look at two systems that are totally intertwined: the endocrine system, which is our body's chemical messaging network, and the musculoskeletal system, which gives us our structure and lets us move around.
Because hormones are basically the body's chemical mail carriers, endocrine symptoms can be really widespread and sometimes seem kind of vague. Think about unexplained weight changes, or feeling constantly hot when everyone else is freezing, or that classic duo you see in diabetes, polyuria and polydixia, which just means excessive urination and intense thirst.
Sometimes, a hormonal imbalance can literally change a person's appearance in very specific ways. This slide shows a perfect example: the moon face, that's linked to Cushing syndrome. This condition is caused by really high levels of the stress hormone cortisol, and it leads to this characteristic round, full face. It's an incredibly powerful visual sign that points directly to an endocrine problem.
Now, in the musculoskeletal system, symptoms and signs are often just two sides of the same coin. A patient might come in reporting the symptom of painful, stiff joints, especially in the morning, and then the doctor can find the matching signs. You can see visible swelling and feel warmth and redness over that exact same joint, all objective indicators of inflammation.
So, we've gathered all these different clues from all over the body. A symptom felt by the patient over here, a sign found by the doctor over there. So how on earth do clinicians take this big collection of information and turn it into a single, accurate diagnosis?
This quote from the medical world just captures it perfectly. What it's really saying is that before any fancy scans or expensive lab work, the most powerful diagnostic tool is a clinician who really listens to the patient's story and knows exactly what physical clues to look for. It's all about being a great detective.
In the end, the whole process is really a form of expert pattern recognition. Step 1, listen, and listen carefully to the patient's story. Those are the symptoms. Step 2, conduct a thorough search for objective evidence. Those are the signs. Step 3, connect those clues, looking for a pattern that matches a known condition. And finally, step 4, use that pattern to form a diagnosis. Your body is constantly communicating. The real question is, are you and your doctor listening?